My name's Chris Blyth. I'm an infectious diseases physician and head of infectious diseases at Perth Children's Hospital. I'm here to talk to you about coronavirus. So coronavirus is a new virus that's circulating globally at the moment and causing unprecedented numbers of cases of severe lung infection. At the moment in Australia we have a limited number of cases, but clearly we are concerned about spreading cases in Australia at the moment. How does coronavirus cause disease? Well, it's a respiratory infection, so it causes usually fever, cough, breathlessness, and sometimes upper respiratory tract symptoms such as runny nose and sore throat. Many people ask me whether children are being affected by this infection. Importantly, I'm reassured that internationally very few numbers of children are being infected by this. In fact, the elderly and those with underlying risk factors are at much greater risk than young children. But importantly, we're keeping a very close eye on this to make sure that our children that we look after in this hospital are protected against this infection. We know those at most risk of coronavirus are those who've travelled internationally or those who've had direct contact with someone with coronavirus. Coronavirus emerged out of China, but it's now been seen in multiple countries throughout the globe. So those who've travelled internationally in the last 14 days are at greatest risk. The majority of confirmed cases in Australia are those with international travel. And so anyone with international travel in the last 14 days who develops fever and respiratory symptoms should be tested for this virus. We also know that those who've had direct contact with someone with this virus is at risk, and so we'd also recommend those who have had direct contact and develop acute respiratory symptoms should be tested. We are not recommending testing in those without symptoms at this stage. What are the symptoms that we're most looking out for? Fever, cough, breathlessness and upper respiratory tract symptoms are the most important symptoms that we're looking out for. What would you do if your child or yourself developed those symptoms? Well, if you'd travelled internationally or had direct contact, we're recommending you seek advice from your local general practitioner or attend a fever or COVID clinic at one of the major public hospitals. If you haven't travelled, we are recommending you contact your general practitioner to seek advice about the next best steps. So coronavirus is largely spread by respiratory droplets. So little bits of the virus are spread in droplets that come from noses and from throats in the form of sneezes and coughs. And so to acquire coronavirus, you need to be in direct contact with those droplets from someone sneezing, or importantly, sneezing or coughing onto surfaces and picking up those respiratory droplets and touching your nose and your face. Parents ask me what the best way to try and avoid getting coronavirus is. The most important prevention is by washing hands with soap and water or an alcohol-based hand rub. What that does is cleans your hands, and any virus particles that you may have picked up around you stops the transmission to you by touching nose and face. The other thing that we're strongly recommending is good sneeze and cough etiquette, covering sneezes and covering coughs to try and prevent the spread of infection from person to person. Thirdly, we're recommending people who do have symptoms to isolate, to stay at home, not spend time in public areas, to reduce the opportunity of transmission from person to person. And importantly, in those who do have symptoms, we're recommending routine cleaning just with a bleach or a detergent to try and reduce the amount of virus particles around them so other people who are well around them don't get infected. These key steps will help slow transmission from person to person, both within the household and within the community, and by doing so will reduce the burden on the community overall. We are living in incredible times, but my message is for people, please don't panic. Stay safe, be kind, and look after your community so that we can protect those around us at this time.